Hi, I'm Sean, and this is my reflection for my clinical rotation. So, I was at Oceanside Physical Therapy. This is an outpatient clinic that focuses heavily on manual therapy. So, if you're at this clinic, you're going to be doing a lot of soft tissue mobilization, a lot of joint mobs, and overall just a lot of hands-on with the patient. So, if this is a skill you want to work on or get better at, I highly recommend it. For me personally, I really wanted to get more comfortable palpating muscles and bones and being able to treat orthopathologies with my hands. So the setting was really helpful for my learning. I would say I learned a tremendous amount here as far as manual therapy goes. And some things that would be helpful to prepare for this location is, I would say, definitely review your anatomy, and especially the shoulder, the knee, and the back, because there's going to be a lot of patients that have these pathologies in the clinic. And as far as anatomy goes, you really want to know the origins and insertions of all these muscles, because when you're doing manual therapy on a muscle or STM, you really want to know how to treat the muscle from start to finish. And so you got to know where it inserts and where it originates so that you can treat the whole muscle. And then also you want to definitely have the actions of each muscle down, because when you're doing soft tissue on these muscles, you're going to be doing a lot of techniques that involve stretching out the muscle, like a pin and stretch. So in order to do that technique, you have to know the action so you can do the opposite action to stretch the muscle. So yeah, just making sure you're comfortable with all the anatomy, especially the shoulder, the knee, and the back, and just knowing the action of all the muscles in those areas too. And then so yeah, I have the same. And as far as any location that involves manual therapy, I would give the same advice to those as well. And then also it's outpatient, so obviously you're going to be doing a lot of Therex. So for me, I've never been an aide before in a clinic, and I've never been a personal trainer. So this is my first time having experience outside of the program of cueing exercises and stretching and stuff. So I would say just practice the basics, practice giving tactile cues or verbal cues, short, simple ones that work for you, so that when you're cueing new people in the clinic, it won't be too challenging for you. And they'll show you the basics there. They have exercise charts. So what I did was, on the first day, I took one home with me and just kind of looked up all the stretches. I looked up all the exercises as well, just so when I go back, I kind of already knew, I had an idea of what it should look like. So I think it's good just to get a basic grasp of the main stretches you're going to see. So hamstring stretching, T-band stretching, quad stretching, and then just knowing basic exercises is going to be helpful for you. And then some challenges in the clinic, I would say just at the beginning, there's a lot of new techniques that aren't necessarily practiced in the program. So while they do rely on the same concepts, they might be different. They might look different in the clinic. So for STM or for joint mobs, you might see a patient in a different position than what you practice in the classroom. So just be ready to adapt to that. It's not too challenging, but it's something that you should be aware of. And then, for instance, for joint mobilization, in the classroom, we kind of just practice doing it in the open pack position, kind of just in that one spot. But in the clinic, you're going to be moving people through these ranges of motions while applying a joint mob. So just be ready to really fine tune that skill. And I would say, if you can, practice it with classmates. That'll be very helpful, especially the shoulder. You're going to be doing a lot of shoulder joint mobs. So I'd try to be expert at posterior glide, inferior glide. Those would be very helpful, I would say, for the clinic. And then expectations. So this was my first rotation. So I started off kind of just watching my CI on the first few days. And for me, this really helped me kind of see how they treat a patient, and what their order of what they do is, and kind of like the overall flow. So I would say like if it's helpful for you, try to do the same thing. Try to just watch like maybe the first day or two and kind of see like how the flow goes, so that when you start treating, it'll be smoother for you. And yeah, expectations, you're gonna slowly see patients, and then eventually by the end you're gonna be seeing like, if it's your first time, you might see like half a caseload to like 3/4 of a caseload, all the way up to like a full caseload. There was a few days where I saw full caseload, so I'd be ready for that. And at this clinic, it's not too many people. Like typically you're seeing 1 or 2 people every hour, depending on the patients you're seeing. So for like a low level patient, like not low level, like a more complex patient, such as like Parkinson's or something like that, you're gonna be with them for like the full hour, so you can really give them like quality care and like be able to like progress and regress them and see what they're doing, versus like an ortho patient, like a knee or like a shoulder patient. Typically you're going to be seeing them for 30 minutes, so this is going to include like doing like they're going to be on a plinth with like the hot pack, and then you're going to take the hot pack off, and you're going to do manual therapy for about 10 to 20 minutes depending on the patient. And then typically you're going to get an aide, and then they're going to help take them through like the exercises, and then you go see another patient. But like I said, it really depends. Sometimes you see a patient for the full hour, sometimes you don't, so it just depends on the patient. And then obviously responsibilities are going to include keeping the patient safe, progressing and regressing exercises. So typically a goal of the clinic is that every time you see a patient, you give them 1 new progression. So make sure you have some good theoretics knowledge of as far as like advancing and regressing exercises, because this will be helpful for you as well. And then you're gonna be making HEPs as well. I made quite a few HEPs there, so just knowing how to make one pretty fast is gonna be a useful skill as well. And yeah, overall I really like the setting. I feel like the workload was really good. The pacing was really good. Practicing the manual techniques was really fun and insightful. I really like them. So I think this is a skill that a lot of therapists can improve on for sure. So I think this would be a great setting. And as far as myself, I think I could definitely see myself working at this setting. And yeah, that's it.